and we're in 30 countries.
Okay. That's amazing. Okay.
It would,
So,
we, the more amazing number is that at least 35 million needle procedures have been done with Buzzy, but because we very intentionally made it reusable, um, we are a profitable company, but we are tiny because when you make a device that is low priced and reusable, it's really difficult to get the medical device reps interested in selling them because they're going to sell 2 or 3 to a hospital unit, and that's not enough, that's not
you
worth
don't
it.
have to replace stuff, and yeah, no, I
Yeah,
understand
the
that perfectly.
replacing thing is the trick to making a profitable device, and I just didn't think that was ethical.
Okay. One thing I'm curious about is you originally did research with topical anesthetics.
Mhm.
Okay. Uh, does Buzzy complement topicals now, or is it totally to be used instead of? I'm curious what your thoughts are regarding that.
Yeah, so this is a really interesting discussion in the time of coronavirus.
Right.
Children's Healthcare Philadelphia did a study comparing Buzzy to Elemax. And in kids 4 to 18, the pain relief was equivalent,
Hmm.
but you can get your lab work done in 3 minutes with Buzzy compared to 40.5 minutes with Elemax.
Okay.
So if you're trying to speed throughput in an emergency department and get kids in and out, um, if you're using, or adults, but if you're using topical anesthetics, you're going to save 37 minutes per patient by using Buzzy.
Right.
So
Okay.
that's something. And the pain relief is equivalent. Now, a study was done in France looking at Buzzy for children versus the EMLA patch. So they did it in a huge number of patients so that they could find something that was statistically significant, but they only did it in kids who were under the age of 6. And it turns out that the thickness of the skin for babies age
Mhm.
18 months to about 4 years is so thin that the ice is uncomfortable for them. So we actually don't recommend using the ice with children who are that age unless you let them touch it and they can tolerate it. So that study found that EMLA was slightly better. The Venn diagrams were like, here was EMLA and here was Buzzy. So it wasn't much different, but because it was such a big trial, it was statistically less useful, but they used ice on all these babies. And I still think that we don't have a good definitive EMLA study using it the way it should be used, but it was certainly really close. And one thing they say was, if you don't have an hour, the time it takes to use Buzzy is essentially at 0 to your IV access. So if you're trying to speed things up, then Buzzy is a really good alternative. For the children who have cancer and the children who have really chronic needle procedures, some of them will use both EMLA and Buzzy at the same time, or LMAX. LMAX is only superficial, so it doesn't work for IMs or injections or sub-Q. It just takes care of the needle touch on the top. So it really depends what you're using it for. Buzzy's going to penetrate more deeply, but if you've got time to wait for EMLA, there's no reason not to use both. EMLA
So you
goes
could
down
use
to
both.
6 millimeters.
Yeah, very good. So we're going to get a little bit into science, and this is so fascinating, Amy. I want to tell you, I mean, the stories that you're telling are just fascinating. So, okay. So tell me quickly about Shark Tank and when that was and what the experience was, because I saw it and it was fun.
So I had gotten a little grant from Huggies, and the people who got the Huggies $15,000 Mom Inspired Award, Shark Tank started asking us to be on Shark Tank. So the first 2 years they contacted me, but there was an equity clause and it wasn't worth giving up equity. The 5th season, Mark Cuban told them to drop that. And so I still had to submit all the stuff, but it wasn't like I had to audition really. It was just, they knew they wanted it. Sometimes Shark Tank wants stupid products. So a
Yeah,
vibrating bee for needles.
yeah.
They like to be able to make fun of things. By the time we went on, it was apparent that this actually was something that worked and was a breakthrough technology. So they changed the focus of the interview toward more positioning this for a breakthrough type thing that they were going to fund. So it was a mental bungee jump. 6 months, you don't know for sure you're going to go on. So
Right.
every month you're practicing your pitch, and you've got two producers who are making it sound even better. And then all of a sudden you get 1 week's notice that they want to fly you out to California to film. But I was willing to take a deal with Barbara. I wanted a deal with Barbara because she had Ava the Elephant and she had distribution channels. But
Okay.
I didn't want to deal with anyone else because they didn't have medical device experience, and it's complicated.
Right. So my recollection is that you declined the offer or whatever, or you wanted more or something like that, or
Well, they once I knew that Barbara wouldn't make a deal with me, so I was willing to do 10% equity for 500. I was willing to do even 20% equity for $500,000 for Barbara.
right.
But when she didn't want it, it's the most expensive money you're ever going to take in terms of the equity thing. And by then they already had so many different companies. I knew I wasn't going to get a lot of attention.
Right.
So what I didn't realize at the time is they had me in a slot where I think that they expected me to go for a deal. And once Barbara was out, I just didn't want to look like a jerk on national television.
Right.
So we ended up negotiating for like an hour and a half. And they weren't willing to go to 20%, and I wasn't willing to take the 10% because I didn't really want to do a deal with the guys anyway. I wanted Barbara. So
There you go.
they were mad. They're still, some of them are still mad. I am in touch with other sharks who with other Shark Tank pals, people who were on the show. We had a 10-year reunion this year in New York, actually. And
Wow.
it's just such a dehumanizing process in many ways. It's nice to have other entrepreneurs who have gone through the same thing.
Right. Very, very interesting. Okay. So tell me the best way to use the Buzzy, and I still remember the phrase between the brain and the pain.
Oh yeah, and we've also got to put the shot near the dot now. So the best way to use the Buzzy.
Okay.
Yeah, so this is the XL size, and the difference between the XL size and the mini is that this one's about 36% larger, but it's got a slot so you can put the tourniquet on it. So if you're going to do a sub Q back here, for example, you can attach it with the tourniquet so it'll stay put. Mm-hmm. You do not need to use an additional tourniquet if you're doing an IV. So you're just going to put it proximal between the brain and the pain. If you're going to do a hand IV, put the Buzzy on, and just with the ice pack, turn it on. People always ask, well, won't the ice vasoconstrict? You don't put it directly on, and so the warm venous blood is actually traveling toward Buzzy in the ice. So unless you leave it on for a long time, then the area you're going for doesn't have cold next to it. It's going, the blood is flowing toward the cold. So you put it on, you turn on the vibrating unit, and the switch is there. And so you've got, this is where the most intense numbing is. So you've got these two things. And so then you just go ahead and clean it and do your IV access. So this is going to be up above. If you're doing it for an IM, then you can either use the XL unit or the mini. And so for an IM, you can either strap it on the XL with the tourniquet and then just sort of push it out of the way and squeeze and go. And this is where the IMs, because it's deeper, whether it's IM or sub-Q, anything that's not the very superficial layer before the vein, it's going to be more painful. And so you need to leave it on so it can desensitize and penetrate down to the Spicinians. The other thing is ice gives you a feedback loop, and that's called descending inhibitory control. So ice is not going to give you a pain relief immediately, but over about 30 seconds to 45, it's going to start this feedback loop where your brain says, okay, that's unpleasant, but it's not dangerous. Let's just shut down all the sensations in that area. So that DNIC thing is why we say leave this on at least 30 seconds for an IM. And people who are doing Humira before citrate, Humira or Lovenox or really painful stuff, do that for about 2 minutes. So you're going to leave it on and then slide it up and do the injection just below it.
And so that's you're showing it, but it's with a tourniquet too, correct?
Well, it can be. Yeah, it can be. So we've got kids, so if you're doing, I know, let's see, I'm going to turning off the vibration, but imagine it's on. So we have doctor's offices where if they're doing 4 shots, The children will do crisscross applesauce, put their arms like this, hold it, and then when they're ready for the shots, the nurses just help them scoot it up out of the way and then give the shots right below. So they can do 2 at the same time.
Okay.
So that's one option. If you're an adult and you're going yourself, putting on a tourniquet one-handed is hard. And so if the doctor doesn't know how to do it, or the pharmacist giving you a flu shot, then you just hold it yourself and you can look away and put it
Okay.
up.
So let's talk about this for a second so I'm clear. So we talked about between the brain and the pain, but what you're doing for IM injections is you're actually numbing the spot where the injection's going to be given, and then you slide it up.
Right. And that's an important point, that the amount of direct numbing really depends on how painful it is. IM injections are more painful than IVs.
Right.
And so, and if you're using it for abscess or injecting lidocaine, so injecting lidocaine is more painful than an IV because you're putting a substance in. So you really want to use that numbing amount proportional to how painful it's going to be. So the other thing is that you have to know where the dermatomes are. So between the brain and the pain is nice because it rhymes in English, but the brain, when I say the brain, it's really the nerves. So for example, for stomach injections, so one of the companies has just come out with Buzzy included for an immunoglobulin infusion that goes into the stomach for 20 minutes. So if you've got something going into the stomach, you're going to put it here, the nerves come out of your back,
Right.
and they go around in lateral dermatomes, just like the patches that you see with shingles. So that means that if you're going to infuse right here, I'd numb this area for 30 seconds, slide it, then input the needle and leave this in place, blocking. So the nerve signal is going here to the spine and then up to the brain. So you don't put Buzzy like this for a shot here. You've got to put it where the nerves are.
Right.
So it's easy in the arms because the nerves go straight up. But if you're putting it in a thigh or in the buttocks for IVF or testosterone or anything like that, you've got to know where the nerves are.
How can you use it for laceration? And I treat a lot of warts. Does it have any application there?
Sure, it's the same pain nerve. I mean, that's why you can do
Pain
it
is pain.
for post-surgery. Yeah, pain is not pain, but in this, any A delta nerve, so any sharp acute, it's not the same for neuropathic pain. So shingles or CRPS, it's not what I would go for that. But
Okay.
for procedural pain, it doesn't matter what kind it is, or injury pain or inflammation pain. So if you're doing it for warts, say they're on the fingers, you're going to put it, just put it as you want the dot. You want this little part as close as possible to the needle. So if you're going to be curating right there, you would just keep moving Buzzy proximal.
Okay.
If you're using it for a laceration, then I would use it for the injecting of the lidocaine. So just again, in fact, here's an interesting story. So I was sewing somebody up and they had a laceration on their leg like that. And so I had the Buzzy here, I was injecting lidocaine. And then when I got to here, they screamed bloody murder. And I was like, wow, that's a real distinct radius of where the effect is. But the reality was, it wasn't the radius, it was that other part of the shin is a different dermatome. And so if I wanted to inject there, I should have switched Buzzy to the other side of my leg. And, I should have switched Buzzy around to there and then done the injection. So, most of what I know about Buzzy, I've learned since I invented it. The invention was just because it worked, but hearing other people tell stories, using it in the emergency room, the feedback that we've gotten from people is a lot of clinically how I now understand the physiology of why it works.
Right. Very, very interesting. One thing I'm very curious about is for decades, they've had the ability to do needleless or needle-free injections. And it has very, very limited use, although theoretically, it should work. And a lot of the fear of vaccination is needle phobia. So tell me more about that and why there aren't needle-free injections now.
Well, the primary reason is because it hurts more than needles.
Well, that's a good reason. Okay.
So the other thing is that there's a study I saw at Pain Week about 2 years ago, but looking at auto injectors versus drawing up medicine and injecting versus needle-free. The needle-free contraptions are more confusing. The patients, it was like 1.2% preferred needle-free injection. Most people, about 70%, preferred the auto injectors, and the rest of them preferred the automatic, pulling it up. So the thing about auto injectors, first of all, Buzzy is an FDA class 1 that is not a it's not a companion product. It's so auto injectors, you have to actually do tests with every single medication. And so Buzzy, you don't. Buzzy controls needle pain, but it's agnostic to what drug it is. So you can use it for needle fear or pain, whether it's lidocaine or pegosparaginase. It doesn't matter. So one thing that has slowed the adoption and probably the improvement of needle-free injectors is that each of the different drugs has to be separately tested with the auto injectors. The other thing is it hurts. And so because it still hurts as much as a snap, even though it's fast for military or for situations where you really got to give a whole bunch of vaccinations at once, it isn't a solution for pain. And so it doesn't, one study was done with Buzzy for patients in New Zealand who were not taking their iambicillin for rheumatic fever, for the rheumatoid factor, or not rheumatoid factor, but for
rheumatic heart disease prophylaxis or something.
Exactly.
Like yeah.
So they had a whole bunch of people who were not compliant because they were afraid of the needles or they were afraid of the pain. And after 3 times of using Buzzy, their fear reduced by half. And that is a pretty typical result. In order to reduce the fear and the pain perception that gets ramped up with fear, it takes desensitization. So a needle-free injector is not going to desensitize your fear if it still hurts the same.
Okay.
Microneedles are great though. Microneedles, I'm ready.
Yeah, so that's the next big thing. Microneedles, it's a patch with microneedles, and I know they're doing research on that now. So we'll have to have you keep me apprised of that progress. So
it's combination product. So microneedles are also a combination product, meaning that every vaccine or every drug is going to have to be tested with the microneedles before they can be implemented to make sure it still works. So Buzzy's not a combination product, but auto injectors, microneedles are.
Right. Very good. So I want to just talk about a couple more things, and then we'll end the interview. One, I know a few years back you had a very important paper. I think it was in pediatrics, talking about the degree of needle phobia among kids getting immunizations and the number of vaccines they get at any one time, right? And you presented your data, several times. Tell us about that.
Right. So that's actually the only NIH-funded study that I've published. And the idea was we had much more needle phobia than expected, 63% of the adolescents. So we looked back at their shot records and found that it doesn't matter how many injections you get at the same time as a baby. What matters for needle fear is whether you remember and how traumatic it was. And one really cool takeaway of this is that the children who got their booster shots, 1 shot every time they went to the doctor, none of those kids were in the highest quartile of fear 5 years later. So the vaccination guidelines allow you to give booster shots anytime between the ages of 4 and 6. So you can still stay within the vaccine schedule and just stagger when the vaccines are given and not cause needle phobia. there still isn't a good paper to see whether or not, if you do pain relief, whether or not you can give 3 or 4 or 5 shots at the same time without causing needle phobia. But a woman walked up to me at the last American Academy of Pediatrics meetings and said, I read your paper in Vaccine, 2017, and we've stopped giving more than 2 injections at the same time. And I just want to tell you what a difference it's made in our flu shot clinics for those older children. Mm-hmm. So even just in 2 years, 3 years time, the fact that they've switched to only giving 2 injections at once rather than more has decreased the fear, anxiety, and the difficulty of the flu shots.
Right. So the issue at stake is getting kids vaccinated expeditiously versus the creating of the needle phobia. So in a reliable population, one could err on the side of giving them fewer vaccines to make them have a pleasanter life and experience within the pediatric office. With an unreliable population, maybe you need to err on the side of just getting the vaccinations done.
I mean, I think that it depends on what responsibility you take for public health. Because if you feel like your job is done when they're 18 years old and they go into the world fully vaccinated, then you don't care if they're afraid of needles, except for the difficulty in your flu clinic. But the reason that adolescents don't get their HPV vaccine, the primary reason is needle phobia. That was published by Clark et al. In 2016, and it doesn't go away. So I believe that one of the big reasons that young people didn't sign up for Obamacare is because they're in the generation that's afraid of needles, 63%. They're not going to sign up for healthcare. They're not voluntarily going to get preventative healthcare. There have been other studies showing that people with needle fear delayed their diagnosis of cancer. They took, on average, 6 months longer to get HIV diagnosed, during which time they had 2 additional people they infected. And there's a significant adult public health impact. Blood donation. Why has blood donation dropped? It's because needle phobia. Because needle phobia. It's because young people are usually the ones who are doing blood drives. And even 10 years ago, people who were born in the 90s, early 90s, they only have approximately 25% fear of needles. So those guys were still going to do blood draws. But now the young adults and the college students, well, 63% of them are afraid of needles. So it makes sense that your blood donation is going to drop in half if you've got more than twice as many kids who are afraid of needles.
Right. Okay. So one more thing, in an email you sent to me, that you recently got a FDA clearance to market the Buzzy for fear. Is that?
No, actually, because we have in 2019, there were 2 meta-analyses published that accumulated the data and demonstrated that Buzzy is the only intervention that decreases anxiety. So we are applying for the ability to put that in our indications for use. So it's not
anxiety. Now, anxiety related to procedures.
Yes. So procedurally.
Okay. So in other words, if you've got an anxiety disorder, instead of taking your Prozac, you can't just use the Buzzy twice a day for 10 minutes.
No. Although Buzzy is very helpful for children who have who are on the spectrum, and there is something about the vibration that really is helpful. Just if they even hold it against their chest and turn it off and on. So there have been a lot of different procedures and places where people will use Buzzy for that when their children have autism or are on the spectrum. The other thing that really helps, this whole pain fear focus is important. And so when we realized that fear made a difference, we created something to decrease the fear. So we have a whole series of these distraction posters and cards. And so it turns out this is as effective as virtual reality. The idea is that the anterior cingulate gyrus, which is kind of in here but deeper, it evaluates risk. And so if it feels there could be risk, fear goes up and pain perception goes up. But if you are evaluating something else, then you're recognition of pain goes down because your brain feels safe. So it's been studied, virtual reality versus the distraction cards, and then the distraction cards by themselves have been studied. And so the concept is that it is causing you to figure out a problem, and that makes your brain feel safe and ignore pain. So in this one, for example, it's like, all right, you start with how many monkeys have 3 fingers, or how many monkeys have are wearing glasses. But when you really get to the place where it's going to be painful, then you've got how many monkeys are actually touching the bed. What do you think?
Back it up a little bit. There you go. That's perfect.
What do you think? How many?
Yeah. So I see one. Well, there's 3 touching the bed, except one's in the air.
I've just given you your shot, and I don't sneak it. I just say I'm going to do this. So there's actually 5. 1, 2.
Oh, I see the tail.
4, 5.
Okay.
But even if they get that one, then we say, no, look again. And that's when they're concentrating, that's when you can really do it. So this guy right here, maybe he's touching the bed, maybe he's in front of the bed. Yeah. It's debatable. So that ambiguity is incredibly distracting for if you're just doing one really painful thing.
Yeah. When do you give the painful thing relative to the distraction?
So what you do is you've got the Buzzy on, and then you've got the parent who's holding this, and the questions are on the back. And so what you do is you say, a lot of kids find it's easier to do this if you're nervous, if you're playing a game. Would you like to play a game? All right, you play this game, and then I'm just going to clean this and do what we need to do here. All right, but you go ahead and play the game. So then you're like, all right, which monkey's wearing lipstick? Cleaning. Which monkey is doing handstand? Cleaning. Which monkeys are in the air? How many of your monkeys are in the air? And then you do the, so now you're ready to go. You've got it pulled up. You know that you don't need to aspirate. You're just going to go in. And so now you say, okay, how many monkeys are actually touching the bed? And you can either give it right then if you're doing 2 shots, and they answer you, and you say, nope. And when you tell them they're wrong, that's when you do the second shot.
Okay, very good. I like it.
Yeah, so pain, fear, focus, Venn diagram, pain, fear, focus. You can't just have one silver bullet for pain, because that's not how the brain works.
Very good. So Amy Baxter from Pain Labs, right?
Pain Care Labs.
Pain Care Labs. So thank you so much for your time. This has been very enlightening. I've learned so much myself, and I'm looking forward to sharing this with a wide audience. And I'm sure we'll come back sometime and talk to you about some more interesting things.
Thank you so much for having me. And I'd be remiss if I didn't say that Buzzy is available at buzzyhelps.com, and VibraCool and Buzzy are both available at paincarelabs.com.
Okay, so thank you so much.